Capitol Report is a production of Senate Media Services.
There was lots of debate at the Capitol this week about whether cities and counties can enact their own labor laws. We'll talk with senators both for and against the measure. And is Minnesota ready for universal health care? Stay tuned for this and more on this week's Capitol Report. Welcome to this week's program. I'm Shannon Lurkey. The Uniform State Labor Standards Act would override local government's authority to set labor standards like paid sick time and minimum wage. The bill has been making its way through the House and the Senate this week. Here's a look at some recent testimony from the Senate Jobs and Economic Growth Committee.
To set a standard at a city level, which creates more confusion, creates more of a burden onto my daily tasks that we already have in running a restaurant. I'm here to serve and create a customer experience at the store level.
I really do not take lightly a step to restrict cities and ways to improve local communities. However, there is a significant potential that our cities will inadvertently create a bad business environment that will only ultimately harm the residents they seek to protect.
When we elect our city council members, we have the most intimate relationship with them of all elected officials, and that's where our voice begins. To have our voice then be stifled by having those city elected officials' policies be rendered invalid is a direct affront to us.
So currently I am homeless and have nowhere to go with my children. I'm in a hotel as of right now, and a $15 minimum wage and paid sick and safe time would help lots of families in North Minneapolis like me.
Now joining me in the studio is the author of the Senate bill, Senator Jeremy Miller. Welcome.
Good morning. Thank you for having me.
This is a controversial bill with passionate opposition from citizens of St. Paul and Minneapolis in particular, who have recently passed their own local laws pertaining to labor issues. So why is this bill necessary?
So what I'll say is, yes, there are folks that have feelings about this, passionate on both sides of the issue. I believe this is an incredibly important piece of legislation, especially for small businesses. And here's why. The state of Minnesota has 853 cities in 87 counties throughout the state. As you can imagine, a patchwork of inconsistent rules and regulations related to wages, benefits, and scheduling can be extremely confusing and a huge burden for businesses, especially small businesses. And rather than seeing companies buried with additional rules and regulations, I'd really like to see our companies focused on growing opportunities for employees by growing their business and looking at different ways to possibly expand or invest in their communities, and having fair and consistent labor standards consistent throughout the state is the best way to accomplish that.
Urban areas do have more diverse populations than some of the outstate areas, and considering that Minnesota already has a problem with racial economic disparities, isn't it possible that this patchwork of labor laws could help address that?
I think the opposite. I think the patchwork would actually hurt this situation. You look at wages throughout the country, according to national data, they're on the rise quicker than they have been in 8 years. The unemployment rate in the state of Minnesota is 3.9%, almost 1 full percentage point lower than the national average. So obviously what we're doing here in the state of Minnesota is working. I looked at the newspaper just last night. There were 2 full pages of job opportunities in the newspaper, and what was consistent through most of those was competitive wages and good or excellent benefits I saw on many of those advertisements. And what we're seeing in the state of Minnesota, and really throughout the country, but here in Minnesota, there are more job openings than there are people to fill those jobs. So what that tells me is economics is working, the market is working. If employers want to find employees that meet the needs for those job openings, that are qualified for those job openings, they're going to have to be competitive when it comes to wages and benefits. And it's very hard to go into any restaurant or store and not see a help wanted sign on the window or hiring now. So that tells me that, again, the market is working, and the competitive nature of filling those jobs is driving wages and benefits higher.
But the cost of doing business is different, say, in Pipestone or Warroad than it is here in the cities. Now, a few years ago, when the issue of minimum wage was being debated, there was an argument against raising it statewide because of that issue, because the cost of doing business is different. So shouldn't minimum wage reflect the area that the jobs are in? If people in Minneapolis want their wage to be higher, shouldn't it be up to them?
Well, first I'll say minimum wage is just that. It's the minimum wage. There's nothing in this bill that's prohibiting the city of Minneapolis or the city of St. Paul from paying their employees whatever wage that they want. But when it comes to negotiating wages and benefits from private sector companies, to me, the best way to do that is between the relationship between employers and employees. You cannot get any more local than that relationship between employers and employees. And employees have different needs and wants, and there are different benefit package. It's not just about wages and paid time off. There are health insurance benefits, dental benefits, retirement plans. So what I'd like to see is the negotiations continue between the employer and the employee, so the employee is getting their needs or wants met when it comes to those benefits. Some may want more vacation time, others may want better health insurance benefits. So for a government at any level to come in and tell a private company what they can or what they can't do, to me is concerning, because that is best negotiated between the employer and the employee.
First-class cities have been working on this issue for some time. They've been having debates and listening to their local businesses. What if they want to continue to shape their own policies? Part of the Republican platform has been local control, and so why is this an exception to local control trumps sort of a uniform control?
Well, again, taking away local control would be telling the city of Minneapolis that they can't pay their employees X amount of dollars. The city of Minneapolis, or any city or county throughout the state, can pay their employees whatever they want, whatever their budgets can afford. But local control, to me, is having a relationship between the employer and the employee. You cannot get any more local than that, and I don't think, again, government should be interfering with that relationship between the employer and the employee.
One last question. At yesterday's hearing, a retired labor law professor spoke. She called this an irregular use of a preemption statute and pointed out that the language is vague, or what she said was breathtakingly broad, and would possibly invite future litigation. Does the bill need an amendment, or are you confident that as it stands, it's in good shape?
Well, I'll tell you that I'm certainly not a legal expert. I don't have a background in law, but I will tell you that 22 other states have passed very similar legislation. So this isn't a first in the country. This isn't something that's out of the ordinary. So I don't know what specifically she was talking to. Again, I'm not an expert on the issue, but I will tell you that 22 other states, including many of our neighboring states, have very similar legislation that has already passed.
Senator Miller, I want to thank you so much for your time today.
Thank you so much for having me.
My next guest is the ranking minority member of the Jobs and Economic Growth, Finance and Policy Committee, which just heard this bill, and a lawmaker from Minneapolis, Senator Bobby Joe Champion. Welcome.
Thank you so much for having me.
Some people have said that this Uniform Labor Standards Act is a proxy war between the rights of workers and the rights of employers. What do you think?
I think that it is a war between whether local municipalities should have the right to determine what's best for their residents and the state. When you think about it in real time, this is an opportunity for local municipalities to decide what's best for their people, and they're the closest to their people in order to determine what is best for them. And let's say the local residents don't agree with what their city council is doing. They have an opportunity by which to make their voice heard by voting or going to their person and saying, I like something or I don't like something. when you think in terms of this preemption notion and bringing it on a state level, then you want me, a person who is from the great city of Minneapolis, to help make a decision about someone in northern Minnesota. Even though I enjoy going north and I enjoy the summers up there, I don't necessarily enjoy the winters. But let me say, I shouldn't be the person making that decision for them, because all of our cities are very unique and different, and they require different things. So a one-size-fits-all sort of approach, I don't think is the best approach. And so I see the preemption bill as a way to undermine local municipalities, and I really do believe that local governments are in the best position to determine what's best for their residents.
Those who are in favor of the bill have argued that allowing cities to enact their own labor laws creates a logistical, administrative, and human resources nightmare, particularly for businesses that work across city borders or around the state. What are your thoughts on those business challenges?
You know, I think that we have to do everything in balance, right? I do think that we need to think about those logistical challenges in real time, but I also think we need to consider residents and what they need and what they want. When we think in terms of the capacity for business owners to determine what's best and how they navigate through that terrain, I believe that we have the capacity to do that, and we do it on a regular basis. So here in this instance is no different. We have to consider these things. And one of the things that I was impressed by yesterday when Councilmember Glidden testified, she talked about the various steps and paces that the city of Minneapolis took in order to determine what is in the best interest of business, what's in the best interest of citizens and workers, and they took all that information and aggregated it together in order to come up with an ordinance that they believe that would be helpful and productive. So I do believe that we have the capacity by which to do that, and I think we have to recognize that the people who are in the best place to determine what's in the best interest of all those parties, city council members, local government.
Well, more than 28 states already have uniform labor laws, so more than half. They say it keeps the playing field level and creates a consistent marketplace. Consistency is often good for business. So is it possible that allowing a patchwork of laws is letting government pick winners and losers?
I don't think it's a notion of picking winners and losers. One of the things that was brought to light yesterday by one of the professors, a retired professor from Mitchell Hamlin School of Law, is the whole notion that usually when states, for an example, take a look at preemption law, it usually is attached with policy that people can react to in real time. But when you think in terms of what this bill failed to do, it fails to articulate any policies at all. And in fact, one of the things that Councilmember Glidden, who is with the Minneapolis City Council, talked about is the fact that if the state had reacted in real time some time ago around these important issues, then the city of Minneapolis would not have taken this matter in their own hands. So we have a legislature that continues to articulate these broad policy notions that they want to carve out without articulating with clarity or at all what the law should be, right? And so when we think in terms of a patchwork, that would be true if there, or at least it would be arguable if there were patchwork and then there was a proposal put forth that says, hey, here's how we're going to remedy this problem. But to say it's a problem and say I want to be the one to speak to the problem but don't put any proposals on the table is irresponsible from my vantage point. And so it's a misuse of the notion of preemption.
Well, let's say you're a restaurant owner in Minneapolis and you simply cannot afford to pay your workers $15 an hour and give them paid time off. It's just not conceivable. So to save your business, you move to Robbinsdale or some other suburb that doesn't have those same labor laws. Doesn't this cost Minneapolis tax revenue and jobs?
I would say that is something that the city of Minneapolis would have to think about deeply. Because I do believe that you want to make sure that your businesses have a competitive edge, and you don't want them to be at a competitive deficit, right? Or disadvantage. So I do think you have to think about these issues. And remember, I started this conversation around balance and taking the right approach to weigh all these important issues and all these important notions. And I believe that you just articulated some of the things that the city of Minneapolis or any city would have to think about. And in fact, let's not forget that every particular city in the state of Minnesota signed a letter that says that they oppose Senate File 580, right? So cities really understand their responsibility. They really understand their commitment to their residents. They really understand all the things that they need to balance, and probably most importantly, they welcome the challenge and welcome the opportunity. That's why they ran for office, right? And so for me, and I started this earlier by saying a guy from the great city of Minneapolis, and I'm proud to be from the city of Minneapolis, should I be making a decision about Duluth? Should I be making a decision about the Northwest Corridor as to what's best for their residents? Isn't that the same argument when we were articulating with clarity the minimum wage, which I believe that we should have always argued about a livable wage, right? Herein lies the complexity of the challenges that are before us. And who's in the best place to do that? Local governments. I keep saying that because that is an underlining theme that I believe to be very important, and that's what's missing here in this conversation. So yes, the city of Minneapolis would have to balance all those things, as any city would have to balance those things, because they want to keep businesses there. They want to make sure employees are happy. They want to make sure that there's collective bargaining but between an employer and an employee. All those things are what we invite and we believe to be important as we wrestle with this issue. And that's why I think this preemption bill is premature, unfortunate, and it doesn't really speak to the underlying issues that it really should.
Senator Champion, I want to thank you so much for your perspective and for your time today.
Thank you so very much, and I like the fact that you're wearing purple. Go Vikings.
This week at the Capitol, on Tuesday morning, DFL lawmakers introduced a measure that would create uniformity in how the state handles surrogacy arrangements.
Thousands of constituents in every legislative district in this state will be impacted by this bill and have its benefits. Having children is a fundamental life function, and involuntary childlessness affects people not just physically, but also emotionally and very much financially. The lack of state law means that each of Minnesota's 87 counties sets its own policy in their family courts. And in some counties, parents must hire lawyers and pay thousands of dollars to legally adopt their own biological child.
Not one Minnesota witness expressed any concern about how surrogacy is working or called for restrictions. Instead, they called for reasonable state regulations similar to what our neighbors, that 28 states, have to protect all surrogacy participants.
I have a healthy, beautiful, brave, strong, I could be here all day describing this boy, son who is now 4 years old, all because of a gestational carrier. After over 12 years of infertility and countless miscarriages and heartbreak, I prayed with my husband, talked to experts, researched, and ultimately was thankful to God that there was surrogacy as an option to build our family.
And that afternoon, Republican lawmakers called a press conference to address the report released by the Office of the Legislative Auditor on the improper use of the Vikings Stadium suites.
It is very important to realize this is serious violation of common sense, that we would all say using public property for private personal benefit is a real problem.
Well, it's pretty clear from the OLA report that the MSFA has been using the facility for friends and family. It's become kind of a private club that an average Joe citizen wouldn't be able to use. And clearly, when we set out doing the Viking Stadium, it was meant to be the People's Stadium.
You have an executive director, you have a chair of the board that are basically doing the same things along with a marketing firm, and it's very unclear what the responsibilities are and who's responsible. And to me, it appears like the chair of the board has created a job for herself ongoing, and I always assumed it was her position was to help facilitate the building of that stadium.
Then on Thursday, DFL lawmakers announced a proposed constitutional amendment that would allow Minnesotans to decide on the future of recreational marijuana use in the state.
But the point of all of our bills is really to open the conversation, because we do believe that Minnesotans are asking for this. There's been a real change in attitude across the country. There's been a change in attitude across Minnesota, and all of us have received a lot of communications from our constituents and from people across the state that this is a change that they are looking for.
This is a conversation starter. We are all well aware that our colleagues who are chairs that would give these bills hearings are not interested in having this conversation right now. But you have to have a starting point. And what I've heard from my constituents is, we want you to be bold and take on issues that have social justice.
Shaping the future of healthcare delivery is a national conversation. Joining me in the studio is a longtime advocate for healthcare reform and the author of the book, Healing Healthcare: The Case for a Common Sense Universal Health System, Senator John Marty. Welcome.
Glad to be with you.
Your book advocates for universal healthcare in Minnesota, and you've introduced a bill in the Senate. Why universal healthcare?
Well, we've got the best doctors, nurses, hospitals. We've got the best medical care, medical research, medical technology in the world here, and the worst system for accessing it. We don't have better outcomes because a lot of people don't get access to the care they want. Our system is so dysfunctional. I think there's bipartisan agreement that it stinks. And if the politicians don't comment on it, the public tells them to, because it's a terrible system. I think we need a healthcare system to match the healthcare quality that we have in this state. And that simply says, instead of having a convoluted health insurance system where you have to qualify to get healthcare, why don't we have a system where everybody just gets healthcare the way we have with public schools? You don't have to qualify. You don't have to qualify for police and fire services, so why do you have to qualify to be able to go to the doctor? And simply put, when you do it that way, if we design a healthcare system designed to keep people healthy and help them get the care they need when they need it, it's actually cheaper. Instead, we always try, and our society always tries to do it the other way. We try and say, let's make sure people don't get too much health care. And we spend twice as much as anybody else in the world spends on health care, despite our efforts to stop people from getting health care.
So let's say Minnesota goes down this path, and we're the first in the nation to have universal health care. What happens to the private insurance market? Does it disappear in Minnesota?
Yes, it would. Under our proposal, we'd be saying we want health care for all, not health insurance for some. It's a very expensive system. If you figure out, if you make an analogy, if you use the analogy of schools, if we ran our schools the way we run hospitals, it wouldn't make any sense. Every teacher, end of every day, spend half an hour calculating how much time he or she spends with the students, send it to the office, the billing office. The billing office folded in all the overhead, the utilities, and so on. Then they'd send it out to the parents' school insurance plans. And they'd all pay for different things at different rates. Not all the parents would pay the co-pays and everything else. So the school would need a billing office. Now, how does that improve education? Or how does it save money? It would cost a lot more, take teacher time away from teaching, students' time away from learning, all this into going to billing. We need a health system that focuses on getting people health care when they need it. And that's cheaper, it makes more sense, that's why we need it.
So I was looking at a website called balancedpolitics.org on the pros and cons of universal health care. They had 8 pros and 18 cons, so there was a lot more
quite balanced,
against.
But okay.
And so I just want to go through a couple of these with you. Some people say that politicians and government do not handle programs efficiently. So if we put it in the government's hands, they would just make a mess of it.
And that's often the case for the way things are. That's why our system, I wouldn't call this a government-controlled healthcare system. Under our bill, every person gets to choose who they want to go to for the doctor, the dentist, the clinic, everything else. There are no networks. Everybody's included in it. You pick your doctor. That's not government telling you what to do. That's you telling yourself what you want to do. Who makes medical decisions? Patients and their doctors. Under our current system, it's often insurance companies or government who tells them what kind of care you're going to get and what you qualify for and what you don't. Instead, when you have patients and doctors making the decisions, that's a people-centered, a patient-centered healthcare system. And frankly, the worry that they're all going to get all the healthcare they want. You know, when doctors and patients sit down with each other and talk about options, they very seldom pick the most intrusive, expensive options. It's not like, you know, you find out, oh, I got Friday morning open. I think I'll go get me another colonoscopy. They're so much fun.
Another con is that taxes will go up, possibly then making us choose between defense and education over health care.
Our Minnesota health plan would be paid for by premiums, only instead of paying premiums to, say, Blue Cross or paying them to your employer out of your paycheck, you'd be paying them to the Minnesota health plan. and we'd all be paying premiums. Everybody would be. Premiums would be based on ability to pay. So it's affordable to everyone. Everybody pays something. But the bottom line is, this healthcare system, if you use the evidence from around the world, if you use economic analysis that's been done in our country, it's cheaper to have a healthcare system than to have this convoluted, bureaucratic, gobbledygook insurance system.
So who is managing then this Minnesota Health Plan?
The Minnesota Health Plan would be governed by a board democratically selected by local county commissioners from around the state who are involved in healthcare already. They would elect a state board that would be in charge of running the plan. The board doesn't have all the control over everything, though. Again, as I said, it's patient doctor centered, because there would be 10 legally requiring principles that the board would be bound by. It has to cover everybody, has to cover them for all their medical needs, including dental, including prescription drugs, including vision and hearing, including long-term care, nursing home care. Covers all those things. The patients get a choice of provider. All those things are legally binding requirements on the board. So the board cannot just run amok and do what they want. They have to make sure it's a patient-centered healthcare system.
One more con. Many people argue that competition and the free market breeds efficiency and ingenuity.
You know, if somebody thinks that our healthcare system breeds ingenuity and competition, you try and go to a hospital and find out what your bill is going to be. You don't know. Matter of fact, even if you go in network for a hospital visit, sometimes, the anesthesiologist or somebody was out of network. You can't know what your bills are, even if it's not emergency, even if it's knee replacement and you're planning ahead. There's no competition in the system now. What we want to have is a logical system, the way we fund everything else in our society. I mean, schools and libraries, other public needs that everybody needs. We don't have competition between police departments saying, okay, I live in Roseville, so well, you know, I think I'm going to use the Roseville police for this burglary, but I'm going to use some other police department for something else. You want to deliver services efficiently and negotiating fair prices with providers. The competition is at the provider level. I want to be your doctor, so I'm going to do a better job than somebody else. That's where the competition needs to be.
Before we go, I'd like you to weigh in on Governor Dayton's proposal this week for the public option to Minnesota Care. Is this a step in the right direction? Is this a compromise that you're willing to go towards?
It's not a step in the right direction. It's a good thing to do. I definitely would support it, assuming it's worked out in a way that's going to be functional and workable. But right now, we got so many people who are desperate with these high premiums, everything else. This will give them temporarily an option that they can get into at an affordable rate. I don't see it as a solution. It doesn't fix the bureaucratic gobbledygook system we have. It's so convoluted, people are sick of it, and they don't know what to do. We have so many Minnesotans who can't afford to go to the dentist. They can't afford $10,000 deductibles. They can't afford all these other things. That his Minnesota Care buy-in is a good thing to do. I support it. I think it may help people, but it doesn't solve the problem. We need to have a logical system, and that's what I'm going to keep pushing for.
Senator Marty, I want to thank you so much for coming today.
Thank you very much. Glad to be with you.
Join us again next week as we delve into more topics affecting Minnesotans. I'm Shannon Lurkey, and on behalf of all of us at Senate Media Services, thanks for watching.